Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Daryl to the rescue. It's an interesting group. I hadn't heard about them before, but it's a group called Chromatic Black, and Sanchez and his associates and We the World, a group of people of color who are trying to make a difference and get in transplantation. And so they had a town hall meeting with actually Tony Watkins, who's a transplant surgeon from Tampa Bay, myself, and some others who had received transplants, and they talked about the many issues that are associated with a transplant system that still imperfect and is working on making it equitable as it relates to people of color, which has been working to accomplish for some time, but still has not made it. So anyway, it was a group that consisted of people from Puerto Rico to California. Really wasn't that many people, probably less than 30, but it was people from all over the country. And it was a very successful town hall meeting in which many views were expressed and shared.
I have to apologize to the group for not getting this out in time for everybody to actually attend.
Well, I sent it to you so late because, but I sent it to you the day before the event, so you didn't have much time. Anyway, I just sent around to let you know this is a new group that I hadn't heard of before, Chromatic Black, and but it was a very interesting group that is very different from any of the ones that I've talked with before.
I was told that they recorded the session, so
yeah, they did record it.
When I get that recording, I'll send that to the group.
Yeah, okay, all right, good. Thank you for including that. Yeah. This is an interesting idea that makes sense. Most prescribers aren't aware of how much medications cost. And if they were aware, they might prescribe drugs that are cheaper and just as effective. And so this is a good idea. I think in our profession, physicians really know what the drugs cost. And I think it would make a difference. Because many of the drugs are equally effective. So if it's equally effective, you could use a drug that is cheaper and get the same result. So it makes sense that this is something that is worthwhile doing. It hasn't been done. And I would think that, when pharmacists and other drug people were coming to the doctor's office, they would often give them free medication, which they would give to their patients. But that's pretty much stopped now. So this is a way of trying to cost save for the patients. Because whether you have insurance or not, you still have to pay something for your medications. So, do many of your physicians know what the medications cost? Do you think they know?
No.
Yeah. So I think this is something that should come to pass.
But all those commercials are for all these different, and there's almost like a different medication every day that comes on the advertisements on the TV, and they say ask your doctor about whatever the funny name is, and you know what you're saying is that most of the doctors wouldn't even know the answers to those
They wouldn't
questions.
know how much it costs. No, yeah, and that's something that we need to include in our medical school education, which you've not done in the past.
Dr. Callender, this is Sylvia. I remember my mom had a prescription that was, I don't know, about 100 or $200. And when I said, we can't pay that, the pharmacist said, well, let me see if I can find you some discounts. And she found some kind of discount where it ended up where my mom only paid like $20.
Yeah, remember we had that discussion a time or two ago in which you may have missed it, which they talked about the uh, uh, RX and Amazon and
Yeah, yeah.
actually some others that actually have exactly what you talked about. So
But
it
I was,
makes sense.
yeah,
Makes
my
sense.
point was that the pharmacist suggested and the doctor didn't know anything about it, I guess.
Absolutely. Most doctors don't know much about it, but it's something that should broaden our horizons. Uh, and it's good that the pharmacist was aware of it because, and they have that commercial in which the pharmacist is the one who does exactly what you mentioned that
Mhm.
happened with your mother. And so it's good to keep that in mind and to avail yourselves of, I think Walgreens or one of those big companies, it's not Walgreens, but Walmart, I guess it is, has something like that as well. So, and they have a list of drugs that they have available. But
Mm.
your point is well taken. That it's the pharmacist who often is able to help you with that, but rarely is it the doctor.
Mm.
Dr. Callender, going back to what John said, they might not only know the cost of the medicine, but they might not know how effective it is compared to the standard medication.
Well, the doctor may know that, but the issue they would probably know that, but the issue is that there are many drugs that have the same potency, but they have markedly different costs, and that's what the issue is, that the expense, and doctors are really aware of what the medication costs. Whereas, as Sylvia pointed out, the pharmacist may be able to help you with that. And so when the cost is excessive, you might do what Sylvia did with her mother, let the pharmacist help you. Uh, but another idea is that the physician should also be aware of the cost of the medication. That's something that we have not heretofore been associated with.
All these brand new medicines that keep popping up on the TV in commercials, I don't see how physicians can keep up. I really don't.
Mm-hmm. Yeah, I had a question. I remember seeing the Good RX commercial,
Right.
and I'm so suspicious. I mean, how why wouldn't everybody use Good RX, to save, 10, 15, $20
Because they
every,
don't know about it.
you know,
They don't know about it. That's the reason they don't realize that that's a good thing to do. You're right. It makes it suspicious, but it is available, and it along with Amazon and uh, Cuban's uh, availability, those are uh, ways in which you can get drugs that are cheaper but just as effective.
Yeah, the other reason could just be convenience. For example, my closest pharmacy is a Walgreens that's a couple miles away. But uh, for some prescriptions, they don't take good RX. I have to go to a grocery store pharmacy to get that. That's a little further away.
Interesting. Yeah. Okay. This is an interesting article that winter weather increases the risk for poor blood pressure control. That's I really wasn't aware of that until I saw this article. So I didn't know that the weather, cold weather, would do anything about it. But with that in mind, it means that you should pay more attention to your blood pressure during the winter months. And whether this means the medication needs to be increased or other things need to be changed. It is something that I wasn't aware of before I saw this article that during the winter months the blood pressure control gets worse, and this may mean that you need to increase your medication or not sure what change may need to be made, but some change needs to be made because you need to have your blood pressure in the range of 120 to 130. And we have observed that the people who are more likely, and I remember Joyce has seen this as well as I, that the people who are more out of control than anybody else are the people who know they have high blood pressure, but they don't take their medication appropriately. And if you have high blood pressure, but it's not controlled, then you have a problem that needs to be uh, uh, controlled. Because the goal is not to just take medication. The goal is keep your blood pressure in a vicinity in which your blood vessels and heart and brain are not damaged.
So, am I understanding this correctly that it's saying blood pressure goes up in the winter as opposed
Yeah,
to the summer?
that's what they're saying. Yes.
Why would
Why?
that be, Dr. Callender?
I don't know why. That's interesting. First time I heard about it was when I read this article, but they didn't uh, say why. Uh, but
Yeah, I think it'd be interesting to find if there's any connection to skin color and seasonal changes.
I have a
yeah,
question for Daryl. Daryl, can you find a form, a printable form that we can use to monitor our blood pressure at home?
a form. You need a form to. All you need is paper and pencil or pen. You write it down.
Yeah, I mean, if you wanted to keep it on a computer, that could be anything. Word, Excel, notes, because it's just a calendar date. Your blood pressure in the morning, your blood pressure in the evening.
That's right. It's
Okay.
really a matter of doing. It's very important, especially doing it at home, because there things are pretty stable and your blood pressure is likely to be more accurate at home. So it's a good idea.
Yeah, when I went to the doctor previously before my fractured rib, my pressure was like 165 the first time, over 90, and then he said, well, we'll have to take it again. It went down to 154, but that's still high, over 80. And then I did it at home, and it was 134. And even that's a little bit high, right?
Yeah, it's a little high, but it's nothing like the ones you had before. Also, keep in mind when you have pain, that increases your blood pressure as well.
Okay.
So, yeah,
Dr. Callender, my blood pressure went down when I started using the CPAP machine. I
good.
still take high blood pressure medicine, but that made a big difference.
Yes, that's very true, because uh, obstructive sleep apnea causes hypertension, and so if it's controlled, your blood pressure normalizes.
Is it out of the question for the doctor to experiment with medicines to see what their after effects are? Like say if the doctor wasn't dealing with hypertension, but every now and then he took a drug just to see the effect so that he'd have a better understanding when his patients complained about side effects.
Well, well, but you don't need to do that. I mean, all you got to do is read the side effects. I mean, we know all the side effects. We don't need to take the medication to know the side effects. We know the side effects. We need to be more sensitive to the side effects
Yeah.
and let our patients know that it's important if they get side effects to let us know. Because well, here's the problem, and that's the problem that Carol talks about, is that when you get a problem and you try to reach the doctor, sometimes it's hard to reach him. But we're well aware of the side effects. The real issue is communication and the ability to share. When you find out that you have side effects, as soon as you find them out, you should be able to call your doctor and let them know that you have to stop taking this medication and get me something else because I'm having this side effect.
Okay. I remember, let's see, maybe about 7 or 8 years ago, I was trying to learn how to control hypertension without drugs. And so I got a referral to, I think it was a nephrologist, and he was on hypertensive medicines. And so we had good conversations because, he had firsthand knowledge about the side effects of certain drugs. I mean, it was just a one time referral. And I found out how to control the blood pressure with some natural means. But I mean, that was a great conversation because he knew exactly what I was talking about. If I said, "Well, Norvasc puts you in a brain fog," he says, "Yeah, it's did the same thing to me. That's why I don't prescribe it or take it."
Uh-huh, uh-huh. And then, but your point is interesting. If you have doctors who are not uh, associated with that, they be less likely to understand the side effects. When we first started having, since I've been in practice for so long, I remember when we only had 3 or 4 antihypertensives, and I remember when many of the patients were dying because they would get impotent after taking some of the medications. They would rather die than be impotent. And so this then was one of the biggest obstacles to especially Black men taking their blood pressure medicines. Fortunately, over time now, we have maybe about 20 to 30 antihypertensives. So then it becomes even more critical for you if you have side effects to let the doctor know so they can put you on a medication that doesn't give you the side effect that you're dealing with. This is an article that talks about, when you go to the doctor, they take your pressure sitting up, sitting and then standing. And what they're suggesting is that it should be routinely measured lying down. And it's interesting because most of the blood pressures are not lying down. They're uh, seated and supine. And this article is suggesting that you should also take it lying. I'm not so sure whether that's true or not, since it's rarely ever done in the doctor's office that you get it lying down. You usually get it sitting. But anyway, this study showed that often the blood pressure was elevated even when they were lying down, and that it means that you have uncontrolled blood pressure that should be treated. So this is something that that your doctor probably doesn't even deal with, because I think they are traditioned to getting a supine, a sitting up, and a standing blood pressure, and looking at the difference. And this is an interesting uh, association with supplying blood pressures. So this is something that hasn't caught on yet, but it's something that it's interesting. The other thing that they talk about, of course, is what happens to your blood pressure while you sleep. And some people for whom the blood pressure drops, and some people it elevates. And so these are fine tuning issues that are important because uncontrolled blood pressure causes cardiovascular disease and death. Okay, let's go to the next one, unless you have comments. It's interesting that an article about COVID symptoms, because I just talked to somebody who had a viral infection but was COVID negative, likely to be RSV, but she had no change in abilities to she had loss of smell, but and had the respiratory symptoms, but was COVID negative. So more likely she had RSV. But what they're saying is that often with the new COVID symptoms, the loss of sense of taste or smell is less common. So the new variant is more likely to have a sore throat. It becomes more common than ever before. And so hopefully with the updated vaccine, this will eliminate that for the most part. But it is interesting that this new version of the COVID virus has decreased the loss of sense of taste and smell. And somebody talked about the war that we're facing with viruses, and one thing you can say that vaccination certainly has accomplished a lot. So as these viruses vary, they also modify the way in which they present. Comes a question that I encountered one of my church members who reads my column that I do every month, and she was concerned because she got a vaccine last month, and she was afraid that she would have to wait another 6 months to get the new vaccine. So you have to understand that that's not true. That this is an updated version of the COVID vaccine, and it lasts theoretically for a year. And so whether you've had a vaccine 2 months ago or not, you still should get the new vaccine when it comes out. So no, you don't need to wait another 6 months, even if you just got it last month. For the updated vaccine, the previous vaccines are no longer relevant. because you have new variants that you're addressing with the new updated vaccine. Any comments or questions about any of this? We talked last week also about the long COVID, and this article suggests that even long COVID is less likely with the new COVID viruses. Now, this is a question about expired COVID tests. And many of you know that expired medications often are not particularly less potent immediately after the expiration date. And so same thing is true of these vaccines. These COVID tests, that they have a date of expiration on them. And do they still work? Yeah, probably so for maybe a week to a month after that one. But yeah, if it's expired, they still may work. Now, how long after that expiration date remains to be seen. But yes, the expired test might work a short time after the expiration date. And they are, in the past, we got them for free. That may not be the case going forward. So keep what you have, and if the expiration date is not too far off, you can still use the test.
Dr. Callender, I went to the library in Bethesda, and they were giving them away still. So you can get 2 boxes, 2 tests in each kit.
Great.
Good morning. I also heard yesterday on the news that the president was going to send the home test again to a person.
Great. That's good. Because those are free.
Yes.
Yeah. Okay, let's go to the next one. I think we're expecting a triple demic, which means you're going to have 3 vaccines: the flu vaccine, the RSV vaccine, and the COVID vaccine. And the CDC is expecting, if we're not careful about mask wearing, that we'll have something akin to what happened last winter. Except this winter, we should be more prepared because we never had an RSV virus vaccine before. And of course, we did have COVID and the flu. So we have an opportunity to get the 3 vaccines and prevent this from happening. Now, when should you get this vaccine? You should get this before November at least, because that's the height of the winter respiratory barrage of infections.
Dr. Callender, I had a quick question. The title here seems to imply that wearing a mask and having people stay at home weakens people's immune systems.
Well, that's what that suggests, yeah. But they don't go into detail on that in the article. I'm not sure there's a lot of evidence that what they are proposing is the case, and they don't really go into detail to validate that comment that is made in the title of the article.
That sounds reckless to me.
Sounds Republican to me.
Well, it's inappropriate. Unless you back it up, if you make a statement like that, you should discuss that in your article. But that's interesting way of putting it, especially since you have a group of people who are already immunosuppressed because of medications and other things.
Mhm.
But you picked it up, and I think everybody else who reads the article will pick it up and also notice that in the article they don't validate that's bold statement that they made.
Mhm.
Because in order to make such a statement, you should have some bona fide evidence that shows that
Right.
the immune system is weakened by that, which they don't have in this article. So we all need to get all three of the vaccines. Of course, it is the expectation that most of you already have the shingles vaccine and the pneumonia vaccine.
Mhm.
Enough arms for all these vaccines.
What's that?
I said, we don't have enough arms for all these vaccines.
Well, you can get them in your butt.
You're right.
But do you know
Or-
whether the RSV vaccine is going to be covered under your insurance?
Well, I believe most insurances will cover it. Now, what it doesn't address is those who have no insurance.
Yeah, yeah. I know the shingle shot is not covered by my insurance.
Oh, no? Oh,
No, not the shingles.
and that's something that
Flu.
once you get it, you'll never forget it.
Yeah, I've heard.
Yeah.
I've actually known a couple of people that had shingles, so.
Yeah.
so,
Yeah.
Yeah, Dr. Cal, I remember when I had a PCR test done a couple years ago at Kaiser. It came back reporting that several other viruses that I'd never heard about were negative, but the COVID was positive. And I was wondering, why would they check? I'm only interested in whether I'm COVID positive, but they tested for these other viruses as well. Thought that was interesting.
Yeah, well, I think they generally do that. I remember when in 2000, I guess it was 2019, when I had the flu, they checked for, of course, they didn't have COVID tests then, but they test for the other viruses as well.
Okay, I'm reading where shingles vaccine is available because of the Inflation Reduction Act passed in 2022, that it's available to Medicare people at no cost.
Okay,
Yeah, Medicare is insurance, though.
Right.
yeah, yeah. Well, I
Yeah.
had Medicare, but I must have been last year.
Right. It
said
changed in 2023. Before that,
Oh,
there was a
okay.
copay.
Okay. Very good.
Gerald will like this one.
I don't think so. Anyway, it's an interesting article that talks about dairy and inflammation, and it points out that their feeling is that dairy itself, unless you have an allergy, does not cause bodily inflammation. And they talk more about the products of cheeses and other such things may be more likely to be associated with these so-called advanced glycation end products that occur when protein or fats combine with sugar in the bloodstream. But they allege that milk alone, unlike the aged cheeses and others, do not increase inflammation. Obesity is well known to be an inflammatory condition, but they allege that most of the tests that they've done, if you're not allergic to it, that it does not increase the inflammation. So that's anyway. That's their side of the story, and they don't address the issue of they address dairy intolerance or lactose deficiency, but they don't. They just they say that they consider that almost like the same as dairy allergy, although some would argue that being lactose intolerant is the same as dairy allergy. So, which means, and since we have more of that than any other ethnic group, that's particular importance to us. But that is not addressed here. It's addressed in general, as though you were speaking primarily to a lactose tolerant group. While we recognize that our ethnic group has more lactose intolerance than many other groups. So I was open for discussion, though.
Well, one comment that he makes is when he says most people don't consume enough protein. There's a lot of articles and research that says that Americans consume way too much protein, or much more than we need. But this guy definitely has a bias in favor of eating more protein.
Right. Mm-hmm. Somebody else had a comment? Okay, let's go to the next one then. This is interesting because we have been exposed to lead exposure more than any other group, and apparently lead exposure is more of a cardiovascular risk factor than smoking and cholesterol, which are major risk factors. And when we talk about lead exposure in this country, we have had an inordinate amount of lead exposure, particularly to Black kids and of course, even adults. And we're finding out more and more that lead is bad for the brain and most everything else. So that it's hard to believe that we've been poisoned by lead so much, and that it would be ahead of tobacco smoking and cholesterol is pretty frightening, especially for our children.
Mhm.
Yeah.
And
A
the
lot
way
of people a lot of
would you
people
say there?
automatically associate lead with old paint in old dwellings, but it's also like Flint, Michigan, and water supply systems with the old pipes. And if you live in an urban area, um, Flint, Michigan, New York, DC, your water delivery system is delivering a lot of lead.
And that's dangerous. Yeah. And we don't tend to look for it, which is the problem. So we have it, but we don't even know we have it.
Is there a test for lead in the water?
Yeah. Yeah, you can test it. Do we test it? I don't know. But yeah, there's tests.
I remember one of my science classes, we did a blind test for water. I had 6 different kinds of water, and all the students went around and tasted all the different, different waters that were available, even sparkling water and distilled water and 5 or 6 other brands from the grocery store. And the water that they liked the best, believe it or not, tap water.
Yeah. That's interesting.
It blew it away. Blind test. Nobody knew what they were drinking.
Yeah.
And it wasn't even close.
That's what they were used to drinking.
Yeah. And then tap water varies all over the country. If you
Yeah.
go in the South, most of the tap water is brown.
Oh,
Really?
Seriously.
Wow. Wow. Scary.
Oh,
you have to boil it.
Oh, I've never seen any brown tap water.
me
If you go to
neither.
Mississippi, all of the tap water is brown in Mississippi. Seriously.
No, it's not. No, it's not.
Well,
No,
it's not.
it's not.
I've been all
No.
over Mississippi with brown tap water.
Oh, what city are you referring to? Now I have to speak up for that one.
The Delta,
Oh,
Greenville, Indianola.
Okay, that's the Delta. That's the Delta.
All right.
Mississippi does not consist just of
I've
the
seen
Delta.
brown tap water in Jackson, Mississippi. In Mississippi, I mean Jackson has a very noted water quality problem.
Well, we
Yeah,
know,
that's-
we know per
Yeah.
news that we've heard about Jackson's situation.
Okay.
Okay.
So where you get clean tap water in Mississippi?
Okay.
I need to know
Others,
what cities because I travel in Mississippi.
me too, Daryl. Me too.
Okay.
I was just in Biloxi and I didn't notice any brown water, but I tell you what, I did have some cloudy water when I was in New Jersey. It wasn't clear.
Cloudy, but not brown, huh?
Right.
I mean, when I first went to Mississippi and saw brown tap water, the first thing in my mind was, what kind of shit is this?
Daryl,
Well,
watch your.
I am a living evidence that the Gulf Coast, I can verify it as a living being that I did not see brown water.
This is Sylvia. I know the district has an initiative to remove a lot of the lead pipes underground, and they're doing it free. And they indicated that they will pay for any repairs. So the district is trying to get rid of the
Yes.
old lead pipes.
Yes.
Oh, that's what they're doing in Silver Spring as well.
Yes.
Well,
Yes.
But here's the problem. When they change the pipe system, that shakes up all the residue off the pipes and it makes the water that much more toxic during the changeover. Because that's one of the things they talk about in Chicago. In the city, the pipes are so old, they say, well, we're going to create even a worse problem if we try to remediate it because it's going to cause, a spike in the toxicity.
So they should just boil the water for that time while they're changing the pipes.
Yes.
Or try to flush the system, just don't drink water after the pipe's been changed, just try to, sustain from that for a day or two.
There are things called filters.
Yes. And one of my main concern about water, period, is that back when I was born, I think it was during that period that they put fluoride in the water
Yeah.
because people were having a lot of
Cavities.
health problem. Yes, cavity problem. And so they put fluoride in the water. And so the bottled water, my understanding, and I know my expert, Mr. Darrell, will comment on this, whether bottled water has fluoride in it. Because we noticed, right, because we noticed that a lot of kids are having cavities, and even to the point that the dentist is saying they have soft teeth now.
Okay.
I'm looking at some bottled water right now. This doesn't have no fluoride in it.
Right.
Yeah, some does, some doesn't about fluoride. There's no fluoridated water in Europe. They ban fluoride, and they say it's not a decay preventive orifice for fluoride. So, why do we have fluoridated water in most parts of the United States? Is because the politicians get paid off to require it. But I'm reading from Minnesota Department of Health that says boiling water does not reduce lead levels and may actually increase them. So the best way to deal with if you're living in an area with old pipes that has a lot of lead in the water, vote with your feet. Move. Go to some place where it's got better water.
They again filters.
Okay, I'm going to search if filter gets rid of the lead.
Okay, moving on while you search. This is something that most of us have been witnessing for some time, that this nasal decongestant has been one of the most popular ones. And they have investigated and found that it is really useless. And so they're talking about taking it off the market. And that's interesting because it was something that is very commonly used as a nasal decongestant. The only thing that we do know is that it may lead to hypertension, but
Oh my.
yeah. But anyway, it's coming off the market, so don't be surprised when those who use it for nasal congestion to find out that it's no longer available. 1.76 billion in sales. How about that?
Yeah. My doctor prescribed Sudafed for many years for allergies for me. And then later on, a doctor says, okay, that's what gave you hypertension.
Yes.
And okay, about filters, removing lead from drinking water. If you use a filter, be sure to get one that's tested and certified by independent third party. There's a Brita Elite water filter. That's the only Brita, or I don't know how you pronounce it, Brita,
Brita.
Brita. The Elite filter can remove lead from drinking water.
Yes.
Okay, great. Great to know. Okay, the next one. Here again. Fish oil labels make health claims despite lack of data. And of course, we've had many articles that talk about fish oil for heart health. And most of the studies don't validate that, but it's something that has kind of been talked about by cardiologists for some time now. They talk about the type of fish oil that you should take. And their studies are suggesting that the evidence is not all there. Any other thoughts? Because I know many cardiologists suggest that there are types of fish oils that are of value. But this article is saying that most of the tests are not agreeing with that.
I remember getting cod liver oil when I was a kid.
Yeah.
Yeah. Ooh.
Ugh, ugh. Yeah, yeah. We had no choice. We had to take it though.
Right.
Yeah, one
Yes,
bad taste of stuff.
yes, yes, absolutely.
Only thing worse than that is castor oil.
Oh,
We took that in the springtime.
Yeah, yeah. But anyway, the more we learn, the less we learn. Although, uh, still many cardiologists will tell you what type of fish oil you should use for cooking. Virgin oil is one that they swear by for the most part.
Olive oil.
I have a question, and this is to just for FYI. What is the best olive oil?
Well,
On
my cardiologist says that the virgin is the best, but
yes, yes, but the brand, because we know they're all different, and there's so much research difference on even the extra virgin oil.
I read that different oils have different boiling points and can actually break down when you're cooking with them. So with high heat, certain of those oils you should not use.
Absolutely, absolutely. If it's cold press, you want to use exactly what it says. They have now on the market some that says olive oil for stir frying and et cetera, et cetera, et cetera. But those that you pour over your salad and that you keep the temperature, because that is part of the research that says that if you attach high heat to it, you kill it. You kill all the nutrients in it. But I was just wondering out of curiosity, because that's one of the research I'm doing, is what is the best cold press extra virgin olive oil is for
that,
us.
that's the one that most cardiologists recommend.
Oh, well, thank you, Dr. Callender.
Yeah. This is sudden cardiac death in athletes is a subject that has come up a lot because we've had a number of deaths, cardiac deaths in young people. And as a matter of fact, that's probably the number one cause of death in athletes. And it's frightening. I see they just released Damar Hamlin. Yeah, but he's back playing football, but they dropped him. And Bronny James, who actually had a cardiac arrest and was resuscitated, and the year before, what's his name? Big guy, and anyway, his son had a cardiac arrest also, and so this caused a light to be shed on the fact that so many. Well, you say it's not that many, but still, it's enough so that if you talk about people, athletes dying, it's because of sudden cardiac deaths. And there are a number of things that cause hypertrophic cardiomyopathy, of course, appears to be the commonest, but there are other issues such as arrhythmias, and then, of course, you have unusual vasculature in the heart, like Pete Maravich died from. And so there are a number of issues, and you can have congenital heart diseases that are not appreciated. And so the moral of the story is that we don't really do adequate evaluations for athletes to identify. And of course, that means that you're talking about increased costs because you'd have to get a special tests to look for congenital abnormalities as well as ultrasounds to see if the heart is enlarged. But the question is when we get to the point that we think that it's important enough to do the evaluation of the heart that's necessary. Now, that's not going to help if somebody punches you in the chest or you get a soccer ball that hits you to the chest, because that's different. Because that's a separate issue. Because then commodio cordis is something that isn't necessarily related to your heart condition, but it's related to the fact that you actually have hit the heart and the heart stops. But the other conditions, you can identify hypertrophic cardiomyopathy. You can identify congenital abnormalities, and you can identify arrhythmias. And with a stethoscope, you can also identify arrhythmias. EKGs also identify arrhythmias. So the question is, are we willing to do enough of those tests in all athletes in order to decrease the number of people who die from sudden cardiac events?
Dr. Callender, it seems like that should be a requirement for athletes.
Well,
ECG.
Well, you know, I don't know that it is, though. I know you say it should be, but it isn't. And I think we need to get to the point where it is, because we've seen enough people drop dead so that, and even though the EKG isn't enough, because you really need to get an ultrasound as well to look at the morphology of the heart. Because an EKG wouldn't necessarily tell you about congenital heart defect, but ultrasound might.
Dr. Callender, what do you think about those young men going back to their sports, Rick, after having those kinds of episodes?
I think if you find out what caused it and you correct it, I think it's okay. But if you find nothing, then I think you need to stay away. But most of the athletes have had tests and they've identified pathology, which they have corrected. And when they've done that, they seem to do okay.
Yeah, the two most common sports where people have sudden cardiac events are going to be football and marathon running. But we're finding out that it could occur with basketball players too. Rarely occurs with baseball players because it's not the impact of the sport and the stress isn't as great as football and marathon running. But we know so much about football that it can cause brain damage as well as sudden cardiac events. So why wouldn't you stop your kids and your grandkids from playing football? That seems to be the smart thing for me to do.
Yeah.
And I
But
wouldn't
we don't
encourage,
do it.
although I've run 18 marathons, it's a dangerous sport. Every marathon I've run, just about somebody dies during the marathon because they drop dead on the course.
Really?
Yeah. So it's I wouldn't encourage anybody to do a marathon. It's dangerous. It's a dangerous sport.
Well, how do you get your kids to stop from playing football?
Because the biggest influence is the loudest voices they hear in their ears. You got to be a loud voice, a loud, persistent voice, and got to get them to turn back.
Yeah, well, you know what amazes me is still you see so many families where they still play football, and I would, I'd be afraid for my kid to be playing football, but
Yeah, they talk about Asian parents. They say Asian parents are so loud in their kids' head that they scare them to death, and they get them to get good grades and all of that just because they're a holy terror. But we're so good and gentle with our kids. Maybe we should be. I'm not talking about beating them to death, but I'm talking about talking them out of death.
Daryl, would you let your kids run a marathon? Would you suggest that they Daryl,
Say what?
would you have your children running marathons? You said that's a dangerous sport.
No, I wouldn't. I would try to talk them out of it. I try my best to talk them out of it. You know, like if you're going to live in my house, if you're going to get anything from me, you run a marathon, you're getting nothing from me. I'm cutting you off.
Oh.
Well, why do you keep doing it then?
I finally came to my senses. I don't do them anymore. So I'm saying learn from my mistakes. I made all the mistakes for you so you wouldn't have to make them.
Right, right.
Okay, let's go to the next one. That's quite a discussion. Now, all men in the world, look at this.
Oh my.
This is not that surprising in a sense because we know that HPV comes from the men. But what is disturbing is that many places are not recognizing that and are not giving vaccines to the men. They're giving it to the women, but the women are not the ones who are mainly responsible for this. The men are the causative agents, and so all of the men are the ones who need to be vaccinated, and women too. But the source is the male, and can you imagine 1/3 of the men in the world have HPV, and of course this is the cause for cervical cancer, which kills many women.
Mhm.
Yeah, and since vaccines have just started, maybe what about 10, 15 years ago? Yeah. So
Uh-huh.
yeah. So, but it used to bother me that they would talk about giving the vaccine to women and not give it to men who were the source of the problem in the first place.
Source of most problems.
Well, is there data to support that, or is that just an opinion? Nobody answers that question. Huh?
That's an opinion.
I got documents.
Yeah.
Read the newspaper.
Every day, huh?
On Capitol Hill.
Yeah. All right. So be sure your grandkids get vaccinated. And they start doing sex at what age? 10?
What?
You teachers, what age do they start doing sex?
It's unbelievable. That's all I'm gonna say.
Yeah, you don't want to say, huh?
I'm just gonna say it's unbelievable.
Yeah.
Yeah,
Oh.
yeah. Well,
Well, they say the average age, it third and fourth grade, and particularly fourth grade.
fourth
So
grade. What age is that?
that's
8 years old, isn't it? Isn't it 8?
yeah, 8, 9 years old.
Woo! Oh my God.
No.
Scary.
And most people put their head in the sand because they don't want to acknowledge it, but
Yeah.
it is happening. And that's been happening since the 70s and 80s. But they
Yes.
don't know how to tell parents that because mostly everybody's in denial.
Yeah, yeah. Well, this is was shocking to me that 1/3 of female surgeons report sexual assault by colleagues. It's shocking that most women in surgery have reported being the target of sexual harassment, and 30% they have been sexually assaulted. Wow, that's kind of wow, astounding to me. Even though in surgery, many of the surgeons are women now, but I had no idea that sexual harassment was so prominent among them. Even though when I was chairman of surgery, at least half of the women who came through the surgery program were women. It still never occurred to me that sexual harassment was an issue. And
Doctor, so much now you're recognizing what's harassment. Back when I was dating as a young woman, I was a dental assistant for over 25 years. And when I started, there was a doctor that used to call our office and ask each one, call and ask for you by name and ask you what color underwear you were wearing.
what?
And we would complain to the medical director, and he told us, oh, he's just joking with you. They refused to do anything about it.
Really? Wow.
And offline, I'll tell you the name, but I won't tell you on the name. He's long since deceased, but he used to do that, and they never did anything about it.
That's sad. Sad.
So it's common, and like I say, I didn't. We at first we tee-heed about it, laugh, but then it got to be kind of oppressive because nobody thought it was an issue, and nobody could tell him to knock it off, and they didn't try to stop him. So lots of times you might be harassed and not know you were harassed if you think back in your life for the things that have happened.
No, I was getting ready to say, you were harassed, but you knew kind of that nothing was going to be done about it. So you just you didn't bother because you figured it wasn't no sense in it anyway. Trying to stop it. So,
but I'm just saying,
and it happens more with women. Women, we've been the second class for a long time. So yeah, we just kind of accept it and go on.
And then it's
now, but now the least little thing is sexual harassment.
Right.
And back then they didn't consider it sexual harassment, but now it's coming to the forefront. But years ago, it just that's just the way they are. That's kind of what they would say.
But
that's the way men are.
You're saying that
used to have. That's the way men are. Yeah.
That's what you're saying. That's the way men are.
You used to have cartoons or things where the boss would chase the secretary around the desk.
Yes.
And people would laugh. Or Ralph Cramden would tell Alice, to the moon, Alice, to the moon.
Yeah.
All those kinds of things were harassment too, but we didn't call it that.
No, like you say, you laughed about it. And bosses have always gotten over with their secretaries, not just saying things, not necessarily physical, but just words. But you didn't consider it sexual harassment back then. You knew it wasn't right, but you just didn't think of it as sexual harassment.
Well, the things that these women surgeons are talking about is not subtle.
Yeah.
It's not subtle at all.
No, but I saw one comment that said something about something that was said during the operation, some kind of, and that's almost commonplace in a, it really is.
It used to be. It's not anymore.
No, not anymore.
Well, because now if you do that kind of behavior, you can get fired.
Yeah. Well, if the
but
boss
you're right.
was doing it
In days before, years going by, you're right. Nothing was done about it.
Yeah.
Right.
So you're right. So people were discouraged from even saying anything about it.
But in less dominated, well, I said high profile places, you know, if you're in a smaller job or different, where it's not a lot of people.
Yes.
Your boss does it still exists. I mean, I just left the workforce 5 years ago and it was still going on. So,
well,
you know,
still people are doing things, but they're being called out now.
yeah.
Where before they used to say boys will be boys.
Yes.
But in smaller
Environment.
they're still doing it, and it's not getting called out. It's not getting called out everywhere yet.
No, but you have the culture has to change.
Yeah.
Yes.
It's changing.
Yeah,
it's changing, but
it's changing.
But it's much worse than I think many of us realize when you have 60% of the female surgeons indicating that they've been associated with sexual harassment. That's horrifying.
Yeah, that's a lot.
Because it could be your daughter, right?
Yes. Yes.
Okay, let's go to the next one. Well, this is something that we're plagued with, and things continue to get worse. More than 111,000 people died of drug overdoses.
Wow.
And the big issue, of course, is fentanyl, which just began with what's the guy from Minnesota? Prince.
Prince.
Yeah. Because he was one of the first to die from the fentanyl. And now it's just all walks of life. And just from the age of 1 on up, people are dying from fentanyl.
Yeah, that's terrible.
Yeah.
The little 1-year-old that just died in New York.
Yeah. So sad. Well, it's hoped that the approval of the drugs over the counter will help, but is that enough? And this article talks about that fentanyl-laced stimulants is the reason, and the question is why do we let this happen? I mean, it doesn't just happen, you know.
It's all driven by money.
Yeah, that's right. It's amazing how, although, as we talked about some time ago, there are courses that doctors have to take now to recognize it. But to me, that's just a small part of the problem. But it's still an area that needs to be addressed. But so many people are dying. It's an epidemic right now. Any other comments? Do you think we can do something about it? Do you think we can do better about it? You think we're doing enough?
No.
No, because when you think about these drug cartels, you realize that that is, as somebody said, it's all about money. And, yeah. What she says is so true. What was true 3 years ago may not be true now because the people who are dying now are a different group. They're not necessarily the ones who started off with taking too much medication.
Right.
These people who are innocents, just take something that they thought was just something that was appropriate to take, and it's laced with fentanyl, and nobody knew it until they didn't wake up. So, huge problem, huge problem. NAFLO is non-alcoholic fatty liver disease, and it's a liver disease that is becoming more popular now because of inactivity, watching TV, and not exercising.
Oh.
And so it's a disease that is preventable if diagnosed early enough. You have before the and there's a test that you can do, a liver scan that can identify an early sign of non-alcoholic fatty liver changes, and but the fact is that it can be decreased by control of diabetes, control of obesity, and also by diet. But there's a liver scan that they don't talk much about in this article, but that you can get done. That's it's not invasive either, and you can find out whether your liver has a large number of fat, a large amount of fat in the liver, and this can be addressed and corrected. So, but the emphasis is on exercise. Back to that old thing that we've talked about forever, which is exercise. 30 minutes a day, 5 times a week, and then, of course, decreasing the spine. Spend your time sitting down watching television. So it's important, and your liver, which is about one of the only organs that we know that is capable of regrowing, is a vital organ that you need, just like you need the kidneys and the brain. Yeah. So there is something we can do about it. I saw an article about almonds and how it's good for the skin, and how it involves almond oils and almonds itself. Of course, I know this is one of Daryl's famous hybrids, that, but it does have some benefits. Daryl, what you say about almonds? No comment, Daryl?
Yeah, I had to, I'm sorry, just had to unmute myself. I used to love them, but I stopped taking them when I found out they were hybrids. So I just
Oh
feed
no.
my hybrid. I have a hybrid bias, as you well know.
Yeah. Okay. Well, how many of you actually have used any of these almond creams or skin lotions? Diminishes wrinkles. It's amazing. All the things that they claim almonds do.
I drank the almond milk.
Ah, you did. Does it taste like the other milk?
No, it tastes better to me.
Okay. Even talk about a sunscreen. I never heard of that one before. Oh, okay, well, it's something that anybody else use any of the skin creams? I know the almond oil has become something that dermatologists talk about.
Okay, I just found something about it says the almond is a man-made hybrid of the wild almond, which is notoriously bitter and can be deadly when consumed in considerable amounts. But that's the wild almond that's bitter, because the hybrid version is not bitter, but the wild version is pretty wild, bitter, and can be deadly.
Mm.
Oh,
So that's why they made it a hybrid. Huh?
Yeah.
Yeah. Okay, let's go to the next one. It's amazing what little kids will do. I mean,
Oh,
can you imagine swallowing 8 injection
Eight.
needles while playing? I tell you,
No.
being a parent and dealing with 1 and 2-year-olds is more than a notion, because they take nothing and make it something. Uh, anyway, they were able to find the 8 needles he swallowed
Mm.
and able to save his life. But
mm-mm.
you think about somebody 2-year-old just playing around and swallowing everything he encounters. So,
I was just wondering why 8 needles would be laying around.
they said they made a comment later down in the article that they were used for I think the animals or something, and whoever it was didn't realize that anything around a 2-year-old is going to go in his mouth. So, but you're right. Why would you leave injection needles around? But they did, apparently. Now, this is an interesting article because the truth of the matter is that doctors regularly train on simulators, especially surgeons. And that is part of our routine, so that simulators, pilots use it, and so do physicians. Should we use it more? Yeah, I think we should use as much as possible. Wow. But there's no question that simulation is part of the physician's routine, particularly those who do surgery and surgical procedures.
Mm.
So yes, it is done, and the more it's done, the better. So just as pilots do it, so do surgeons and instrumentalists. If you do colonoscopy or whatever else you do, you can now do it on simulation first before you do it on humans.
Is that VR, doctor? Where they put the
Yeah,
scope over your face and
that's one of the ways you can do it. But actually, we actually have simulation where you actually do it on on models. In other words, you have an imitation of a human body, which has the different body parts, and so it's more than just virtual reality. You actually do it on models, and it is part of the training for doctors now. So uh, this article is good in the sense that it further emphasizes the importance of simulations. Every surgical program now in the United States has a simulating center in which the doctors practice the surgery procedures before they do it on patients. And there's little question that that's correct. That's the correct way to do it. There's an article that talks about if your patient needs money in the will, can you accept it? And I guess the answer is as long as there's no sexual or romantic propriety, that you can accept it. Now, they are talking about situations where doctors leave millions of dollars to patients, which is a little extraordinary. You know, if they just left $1,000, nobody would probably care about it. When they talk about leaving $100,000 or $24 million, as was the case in one of these situations, then you have to consider whether it's ethical or unethical. And you have to be sure that there's no extortion, deception, coercion, or undue influence. And so whether it's, the measure of the law is legal, but ethical is a little more than legal. And
higher standard.
Yeah, higher standard. So if they're gonna leave you $100, it's okay. $1,000 is okay. Start leaving you millions, and then there's a question about the propriety of that. And this is an issue that has become an ethical dilemma for many. You get a box of chocolate or cake, something like that. It's nobody's gonna argue about that. But when it gets up to other gifts like that, it becomes an ethical nightmare.
Dr. Callender, do doctors have to do what they call those financial disclosures when, like, for gifts and things like that?
Not that I know of, no. But when you get $100,000 or things like that, but no, so far that has not become a requirement. Okay, because it's not that often done. But and there may come a time that it would be the case. The pharmaceutical industries, that's another story, because that is part of it. But
I see.
Yeah, it mentioned about giving your doctor a fruitcake. I think that would probably decrease your level of service.
Why would it decrease your level of service?
Because if I was a doctor and I got a fruitcake, that would make me mad.
Why?
Because fruitcakes are terrible.
Yeah, but it's just it's a sign of love. That's all. It doesn't mean that you necessarily have to eat it. But
Right.
It's just a sign of love and appreciation.
They are terrible.
But I've had gifts of food, sweet potato pies and those kind of things. I've had those gifts commonly.
Yes. Yes.
Any other comments about that? Okay, now this is an article that I thought you might find interesting, because nowadays we're treating children with ADHD, adult medication for people who have hyperactivity syndromes. And whether you should do that or not becomes an issue. But 5% of children in this country have received a prescription, and they're talking about side effects from these medications and errors associated, which is unfortunate, because when we were growing up, you had so-called hyperactivity syndrome, they didn't give you medication for it. There is evidence that sometimes these medications are helpful. So there's no arguing about that. But when you're giving children medications like that, apparently the nearly 300% increase in poison control calls. So, and the diagnosis is now so common that it makes you wonder why we're overdosing our kids like that. Doses like Ritalin and amphetamine and those other drugs, which may be addictive in some cases. Would you give your child medication if he had hyperactivity syndrome?
No.
No.
You know, Dr. Callender, back in the day, that used to be the answer. You know, there was a problem, give the person a drug. And then later on, then they found out that a lot of these children grow up to be drug addicts because their bodies are used to taking something outside to fix something that's inside. It's a whole different issue.
Yeah.
I came across that with my son that passed. He was hyper, and what got to me, it was these little novice teachers, and they wanted him to sit still all the time, and they didn't have recess anymore anyway. And they were the ones that wanted to prescribe Ritalin for him, and their teachers are not professional to assign Ritalin. And so you go to your doctor and say the teacher said that he needs Ritalin so he could sit down. And I did not agree with that theory whatsoever. But it's a lot of time it's the educators because they're pressured to teach 24/7. And just like in Japan or Asian countries, and they're beginning to relax and let children have more free time and recess because they've taken recess away. But like you said, in the older generations, our generations, children were able to run it off and et cetera, especially the children that were really hyper. And then they had to learn how to sit still, but a lot of adults just can't sit still, not even through any service or anything, because they got to constantly move. And you don't need drugs for that. I don't believe so. I didn't enforce him to have it. He just had to, because I had one older aunt who said she was hyper. So I don't believe in it.
Well, it's an interesting topic. You know, I think my wife says that I have a hyperactivity syndrome, but I didn't take any medication and I survived. But these days, a child who's labeled as hyperactive, they give them medication and they suffer the consequences. And I tell you, I side with you unless you have somebody who really can't keep still. And it may well be that for that child, after they've had appropriate interaction with the therapist, might have it, might need it. There can be a case where for it, but I wouldn't do it just willy nilly. I think it has to be, to me, it has to be ordered by somebody who has really looked into the child's condition and decides that there's a medical reason for that situation. Because it does help some children. It does help some.
Yeah, but some of the children that I had in classes, they said it made them feel lethargic. It helped them to focus more, but they did not like the way the medicine made them feel, and they would rather not be on it whatsoever.
Yeah. Any other thoughts or comments about it? I think this will be our last article. It's 10:30, and while we have a lot more, I think it's. Any other comments or questions about any of these articles?
Do they have to get the parents' approval to give drugs for ADHD?
Yeah.
Yes, you would.
And most parents don't understand or know. And just to get your child to behave so they don't have to be bombarded with phone calls that he won't sit down in his seat. So parents say, do what you got to do so they can sit down in the seat and you won't bother me anymore.
That's not a good reason.
Because they can't do it. They can't touch the child. They can't even make them write or anything. So the only alternative that teachers have is to call the parent. He won't sit down. Well, you can't say sit down because that's punishment corporal. So they gotta immediately stop what they're doing and call the parent. Like once my son he ate somebody's lunch. Instead of the teacher said, you don't do that, you got to call me and said that he ate somebody's lunch. So I got to wait till he gets home and say, don't eat anybody's lunch. But I mean, those little things that we could take care of in the classroom, teachers are no longer allowed to reprimand or tell the child, because children are always going to do something out of the box because they're children, you know? And but teachers cannot treat them like you got to reason with them. And how do you reason with a 4-year-old? But I mean,
at least they talking to them. When I was a little girl, you would have a board meeting, and my father was the chairman of the board, and that meant you got paddle with a ruler. That was the board.
you can't even suggest that